If you have man boobs, or what we call gynecomastia, I'm going to tell you what it is, how you get it, and how you treat it. So what is gynecomastia? If we're sticking to true definitions, gynecomastia is when a man's breast tissue grows larger than what is considered normal. So in true terms, it's talking about the size of the breast gland. All men have a breast gland, just like all men have nipples and areolas. So when someone has gynecomastia, technically it's referring to that size of the breast gland becoming larger than normal. However, there are more elements than just the breast gland when you're assessing a man's breast area or chest tissue. So not only is there gland, but you also have to think about fatty tissue content and the amount of skin excess, because when you assess a patient, they might have different amounts of both. So when a man has excess fatty tissue in the area of the breast, you might actually call that pseudogynecomastia. So the breast looks large, but if the content is mostly fat and not gland, it's technically not gynecomastia, but you still might see a plastic surgeon to help improve the aesthetics of that area. And when you're talking about skin as well, it can be another form of pseudogynecomastia. Classic example, someone has had massive weight loss. So they've lost a lot of body fat, and in the process, when they were overweight, their skin stretched. And then when they've lost weight, the fatty tissue goes away and the skin starts to sag. So it looks like they have a lot of breast tissue or volume, but a lot of it is extra skin. So you would also call that pseudogynecomastia. So it's kind of a little bit semantics, and it depends if you're talking about the breast tissue or an assessment of the overall breast gland. So gynecomastia technically is the growth of the breast gland, but there are other fatty tissue components or skin laxity components that can contribute to the appearance of a man's chest or breast gland. That might be a reason that they see someone to get aesthetic improvement in that area. So how do you get it? So sometimes it's just bad luck, or what we call physiologic. So you get it throughout your lifetime related to hormonal changes during puberty or later in life. Drugs can cause it, like marijuana, medications for blood pressure, other prescribed medications from your physician, anabolic steroid use. And there are other medical conditions that can cause it. Certain tumors that increase estrogen content, or liver problems that increase estrogen content in the body, and also thyroid problems can cause it. So what are the treatments for gynecomastia? I always say when I meet a young person with gynecomastia, especially if they're sort of in the pubertal age, you gotta wait for a period of time and see if the extra breast tissue will go away on its own, because sometimes it does. Or if someone's still in the first couple of years during or after puberty, the size of the breast gland may still change or evolve. And in general, with any breast surgery, you're gonna get a better result if you wait till things are stable, because otherwise you're trying to hit a moving target and then you might not get a very good long-term result. So aside from that population where you might wait and see if it resolves, assuming that it's not caused from a medical issue, and because if you have gynecomastia related to a medical issue like the tumors that we mentioned or other hyperthyroidism issues. So if there's a medical problem, you got to treat the medical problem. So now we're sort of focusing on the population. There's not a medical problem that has caused it. It's not going to go away on its own. What do you do? There's no non-surgical way to get rid of extra breast tissue in a true gynecomastia patient. So what do you do from a surgical perspective? You have to break it down to the breast component, the fatty tissue component, and the skin component. So that assessment has to be made with every patient when you meet them. So when I meet someone and you examine them, you palpate the gland, you can usually get some sort of a sense of how much of this is breast gland versus fatty tissue. And sometimes you can do investigations like an ultrasound to help you find how much breast gland is in there. But anyway, I guess what I'm trying to say is you're looking at surgery and you have to plan the surgery based on what the patient has. So to remove a breast gland, you need to make an incision somewhere so that you can access that tissue and then remove that tissue. The most common way to do it is to make an incision around the top of the areola. And through that incision, you put in a retractor, you find the breast tissue, you dissect it out, and you remove it. If someone has a lot of fatty tissue in the area, It's not going to look good if you don't do liposuction generally. So with liposuction, in addition to going in and removing what breast gland is there, you might add an extra little incision sort of at the bottom outer aspect of the breast tissue. And through that little sub-centimeter incision, you put in a cannula, you suck out the fat. In the third population, so I would say for most gynecomastia surgeries I'm doing a combination of both of those. But so what do you do in the population where they have a lot of skin excess? So you have to tighten the skin envelope. There's a couple ways to do it, and it depends on how lax the skin is. If the skin is a little bit lax, you might just accept it, remove the gland, do some liposuction, and try to tack everything down to help lift the skin a little bit closer to the chest wall. If there's a ton of skin excess, you have to have a plan to remove that. So sometimes you can do an incision that goes all the way around the areola and you try to cinch everything down together to tighten the skin. Or if there's a lot of skin excess, so generally you would only see this in a massive weight loss patient, you would actually approach it similar to how you would in a patient who's doing a female to male gender transition surgery. So you would perform what's essentially a mastectomy. So you remove the breast gland, you can place an incision along the crease at the bottom of the breast, and you graft the nipple back on. I'd say that's the least common way of going forward, but that's sort of an approach that the surgeon keeps in their back pocket if someone has a ton of skin laxity. If you liked this video and you want to see more videos about gynecomastia or other plastic surgery topics, please leave a comment below, give us a like, and feel free to check out my other Instagram and social media pages. And thank you for watching.